And we're back live inside Studio 10, and it's time once again for On Your Health, where we discuss important medical and health topics with the doctors of Florida Medical Clinic, the Bay Area's first clinic to merge both primary care physicians and specialists under one roof. And today we're joined by Dr. Mark Pinals to discuss the fascinating world of diagnostic radiology. Doctor, welcome to Studio 10.
Thank you very much. It's a pleasure to be here.
You're Dr. Radiation. Explain how this works, how radiation and diagnostic, how does all that work?
Okay, well, radiologists, first and foremost, we're physicians, we're doctors like all the other doctors patients see, same medical schools. But then when we go into our training, instead of making diagnoses based on just history and physical exams, we use images and image interpretation to help diagnose the patient's problems.
And explain the radiology component. Obviously, this is something that I think most of us associate with things like CT scans and MRIs, but explain what all goes into that.
Absolutely. When most patients come to the department, they don't even meet the radiologist. They meet the X-ray technologist or the sonographer, and they may be getting an X-ray, CT scan, MRI, ultrasound, mammogram. And once those tests are performed, what the radiologist has to do is basically two things. The first thing I do is I look at the pictures and I try and find every bit of pathology. First, what's relevant, what's not relevant, none of that matters. I try and find everything that I can that might be wrong with the patient, they might need to know in the future, that might be a problem now. Then I look at their medical history, and I try and put together the information I've gleaned from the images with their medical history and make the most pertinent diagnosis. So if a patient comes in with abdominal pain, I may find 5 different things on the CT scan, but I need to know that that little bit of inflammation around the colon is diverticulitis, and that's the problem the patient has today. And at the same time, say to the doctor, their aorta looks like it's getting a little big, they may develop an aneurysm in a few years, and you need to be aware of that, and we need to follow that now so that we can give the patient the best care today and in the future.
So how do you know how strong of an image or how much of a dose of radiation has to go in? Because the more radiation, you were telling us, the better the image, but you don't want to overdo it if you don't have to. How do you know how strong of an image you need?
It's a great question. That's been in the news a lot, and people are very concerned about radiation dose, and I think it's very important to minimize the radiation dose. The problem is it's a trade-off. And we're talking about CT scans now because that's where the most dose is in the department. And when we perform a CT scan, there's a balance. The more dose I give, the better, the sharper the pictures are. But at the same time, I don't want to give too much dose or extra dose because I want to limit the dosage to the patient as much as possible.
But you don't want to miss anything either.
Right.
Exactly. I don't want to miss anything. So how do I find that fine line where I give the least possible dose but still get every bit of detail I need from the images? When the machines first come into the department, whenever we get a new piece of equipment, we work with the application specialist from the equipment company, and we try and find that line. If the images are a little bit noisy, is that okay? Will I still find the smallest tumor, the smallest mass, the smallest bit of inflammation? And it comes from years of experience, but it's also a guessing game. And frankly, that's always been a big challenge and a big problem for radiologists. And, well, that's something that we're working on now. There's a new process going on. The American College of Radiology has created the Dose Index Registry, and it's an amazing tool for radiologists. What's happening is we send our dose data from the CT scan to the American College of Radiology. They then put that information together and compare it with facilities all over the country. So instead of guessing, I know that perhaps my dosage is 40% in the 40th percentile, so I'm giving a little less than everybody else. And I have to think, well, now, is that good enough for me? Or maybe I should be giving just a little bit more because I don't want to miss very subtle pathology. Or if I'm a little bit high, I maybe want to give a little bit less because I want to make sure I'm not giving too much dose. And for the first time, radiologists have a tool that allows them to compare the radiation dosage in their facility on CT scans with facilities all over the country, and we can really do the best image quality while still remaining at the lowest dose possible for the patients.
Well, obviously, this kind of thinking is what Florida Medical Clinic is sort of all about, this idea of being able to share information. And what's it like for you as a physician then to be a part of a family like that where across the board, not just in that particular index, you're able to share information so easily?
It's huge. As a radiologist, my first few years out of training, I worked in a freestanding outpatient radiology center, and all we knew when we were looking to make a diagnosis was patient's age and maybe one symptom. 64-year-old woman, abdominal pain. And that's nice, but When I'm reading a CT scan, I might find 5 or 6 different findings, and I may find a finding that suggests maybe is the patient diabetic? Could it be something to do with that? Does the patient have had prior surgery? Is it something to do with that? And what's beautiful at Florida Medical Clinic is I'm no longer working in a vacuum. I now have the patient's entire electronic health record at my fingertips on the same computer that my images are on. So while I'm looking at an image, if I want to know, well, the lung looks strange there. Maybe they had a little surgery and that's just a scar, or maybe it's cancer, which is a vast difference. I can just look up their medical records, and in 5 seconds, I have the information at my fingertips. Saves the patient coming back for extra tests that they don't need. It saves time for the referring physician, because I don't have to give a list of possibilities, because I know their history, and I can hone right in on the correct diagnosis and really help them.
And we want you to do a quick preview. You are putting together, with that in mind, a breast cancer prevention team that will streamline the diagnosis and treatment process. Can you sum it up in 20 seconds for us?
Absolutely. The breast cancer care team will have a nurse navigator, and as soon as a patient is diagnosed with breast cancer, they'll be assigned to the nurse navigator, and she will literally hold their hand and help them get through the whole myriad of specialists that they need to meet and be overseeing their care so nothing gets lost along the way.
And of course, we will update you on that as Dr. Pinals and his team build that team, and we will introduce you at some point right here on the show.
Thank you, Doctor.
Thank you very much.
Come back and see us. Hey, if you'd like to learn more about the latest advances in patient care and medical research, visit Florida Medical Clinic online at floridamedicalclinic.com. While you're there, you can locate the office nearest you, learn about their doctors. You can even request an appointment. How about that? They make it easy.
They do. All right. Up next, we are going to be traveling. World-renowned travel expert Rudy Maxa has some winter vacation tips when Studio 10 returns.
This segment was sponsored by Florida Medical Clinic.